I didn't want to make a long video, so I just decided to chop it in half. So this is the second half. Hi YouTube, welcome back. This is part 2 of the frequently asked questions, question and answer session. I didn't want to make a long video, so I just decided to chop it in half. So this is the second half. What excites you about medicine? Well, medicine is very cutting edge. Medicine is very fascinating. I'll admit, my first year of medical school was interesting, but it was just like the basic sciences, like biochemistry, neuroanatomy, and stuff like that. And that was okay, but second year is so much better because you're learning about diseases and presentation and prognosis, and you really feel like a real doctor, even though you're not like with real patients yet. But you're just like, oh my gosh, like, do I have this disease? Oh my gosh. When they start describing the symptoms and how long the patient's been having this and what's associated with it, it's really, really exciting. So I do love that medicine is just so detailed and cutting edge, and it's also just forward moving, and I really love that aspect of it. I love being up to date on like the latest research, and I keep myself up to date with New England Journal of Medicine, which is one of the top medical journals. And I love reading their resident bulletins where they have these like rare diseases or like common diseases and tell you these clinical pearls and stuff like that. So I just love a field that is forward moving and constantly evolving. What was the hardest part in preparing for medical school? The hardest part in preparing for medical school, I would say, was the MCAT. When I took the MCAT, I was working full time, and I had my apartment, I had a car and car payments, and I was paying my loans off, and it would be ideal not to work and just study for my MCAT, but my lease, I was like in the middle of my lease, so I tried to make the best out of what I had. And I took my MCAT and I didn't get the best score. And the MCAT really is a big factor in whether or not you're going to get into med school. You're going to have a 4.0 and a really bad MCAT, and you're not going to get into med school for the most part. So I didn't have a 4.0, but I'm just saying that's how serious the MCAT is. So I would say that was the hardest part, and just figuring it out on my own. I didn't really have mentors at the time to tell me that you shouldn't work full time and study for the MCAT, and also that you shouldn't apply to medical school with that low of an MCAT, 20 at the time, which is like 23rd percentile or something like that. So I took the old MCAT in 2014, I believe. Yeah, so it's just, that was the hardest part of getting in. But luckily I did the master's program and that got me in. So what suggestions do you have for a personal statement? I actually just wrote a post on my blog, linked below, about personal statements. As far as personal statements go, make sure that you have a really good, compelling story, because everyone's gonna have that story of why they instantly knew that medicine was for them, and they're gonna write this, Broadway Shakespearean experience, and you want to stand out, and you want it to really be a really impactful story that you share. So you want to convey that to the reader and make sure it's a true story. Please don't make anything up, because if you do get an interview, they're going to ask you about that, and you had better have that same energy in the interview as you had in the story. How did you choose your med school? I chose my med school, but I didn't have that many options because my MCAT was not the best, and I really did not want to retake it, and that's why I did the master's program and got in. And but I did know I did know a few things that I did want out of a med school. I wanted it to be in New York City because I did not want to move, and yeah, I also wanted to go to an osteopathic medical school because of the principles, as opposed to an MD school, because I knew that once I graduate, it's essentially the same thing, but I would have this extra toolbox of knowledge where I have this holistic approach to patients. How much did you volunteer? I think I had like 100 hours, whatever the minimum amount of hours was that was like recommended for most schools, which I think it was 100 hours, I think. But I had at least 100 plus hours. I shadowed doctors that I reached out to online. I went to like the medical associations of different states, and I just like sent like over 100 emails, like, can I shadow you in your office or whatever? And I shadowed an ER doctor, and I shadowed a family medicine doctor who ended up writing my letter of recommendation. And other volunteer stuff that I did, I was a part of Heart to Heart, where we went around New York City and like set up different locations of blood pressure screening, like in churches and consulates and stuff like that. And that was really good. And I also did some like dental outreach volunteer things at like federal daycares and stuff like that. Yeah, I kind of forgot all those stuff that I did, but you know, I volunteer. Got those volunteer hours. How did you prepare for the MCAT? I prepared for the MCAT. I did the self-paced Kaplan course, and like I said, I didn't really have the best study plan because I was working full time from 8 to 7 p.m. and then by like 9 p.m. to like 3 in the morning after work I would study, and then I would study on the weekends, and yeah, it was just not the best study plan. And I also focused on just getting through each module and just like learning things instead of taking full length practice tests, which is what you're supposed to do. Because if you take a full length practice test, you see like basically all the questions that you're possibly gonna get asked on the MCAT and the content of the questions, and you get to see, oh, okay, I'm weak in biochemistry. Oh, yeah, I'm weak in physics or whatever it may be. But I was literally just studying and reviewing all of the stuff from my prerequisite courses that was in the Kaplan course, and that actually took a lot of time. And by the time I started to actually do like practice questions, it was towards the last like a week or two before the exam, and that's way too late. I didn't even know what like my baseline score was before I took the exam. So yeah. Which you should know what your baseline score is so that you know, okay, if I'm starting in like the 23rd percentile and I want to get to the 80th percentile, let's keep going. But I just was doing it on my own. It was self-paced. So I was pacing myself, I guess. Don't do that. Practice tests, practice questions, see your weaknesses and your strengths, and then go from there and then review your stuff. So what advice would you give to prospective medical students? I would say in undergrad, you want to get the best grades that you can. You don't want to have to like retake classes. I know things happen, but really, if you feel yourself struggling after the first exam, go to your professor, look at the syllabus, ask your professor what can you do to strengthen your scores in your next exam, and also put your all in it. If you get a certain grade and you're not happy with, you need to ask yourself, did I exhaust my resources? Did I ask the professor questions? Did I honestly try my very best? And if that's not the case, then I'm sorry, but you kind of deserve that score. And I realized that about myself too. Like there's some classes that I really did not put my all in. And so when I got grades on certain exams or in the class, it's like, okay, girl, you did not put your all into it. So you should expect to get this grade. And I know there's a lot of circumstances, family emergencies or just like mental health issues or, just feeling down and stuff like that. But besides that aspect, if you're really trying to get the best grade, you need to exhaust your resources. I'm someone who didn't get that good of grades on my SAT scores, and I'm scared for my GRE. How did you study and pass your GRE? I did not take the GRE. My master's program didn't require the GRE. It required taking the MCAT, which I already did. But like I said, it just goes back to practice questions, practice full-length tests, and then studying the things that you are weak on. Also, check out my blog because I did have a post about studying for your MCAT, GRE, and stuff like that with links there. How did I pay for my master's? Federal loans again. And these federal loans are really good because it's not based on your credit. It's based on, being a student. And yeah, you will have to pay them back. But at least it's not based on your credit, which can be really hard to get for a lot of people. Are you scared of student loans? I am not afraid of student loans because I know that I'm going to eventually be making money to pay them back. It's a fact of life. I mean, President Obama and Michelle, one of them or both of them, paid off their loans like while he was still a president. So, I mean, if he's still paying off his loans, whatever. I don't care. Like, this is my degree that I'm trying to get, and this is the career, and I'm not going to let loans tell me that or make me not want to go and achieve it. So I don't think you should be either. Are there any apps you use for planning? No, I really just use the Notes app in my on my iPhone, and I just plan out my day. Like I'll just put like 6 a.m. to 8 a.m. do 2 hours of UWorld questions, 10 a.m. to 12 p.m. break, clean, blah blah blah, and that's just how I go on with my day, really. But I do use the Focus Keeper while I am studying to break up my studying time and give me a little, social media break or texting break or food break. Someone asked, was getting your master's fast-paced? Yeah, the master's was fast-paced because it was first-year medical school courses, 20 lectures per exam, stuff like that. It's like undergrad on steroids. Do you suggest online or in class? Do you suggest online or in class after undergrad? That depends on the person you are. Personally, I don't like lectures, so I would do an online class. If you're a person who likes to sit down in lectures, then, do it in class. But most of us, when we graduate from undergrad, we have jobs, and it's hard to actually get to class. But being in class sometimes also makes you more focused because, you have to be there and, the professor is lecturing. I just don't like lecture unless you're a world-class teacher. And when I sit down, I'm able to learn everything in 1 hour. That's kind of rare, so yeah. How many minorities are in your class? Oh, minorities. Okay, my class is about 113, I think. And I would say I'm going to say 20 minorities. Okay, we'll say 30 max. Because, okay, we won't say 30 max. I think there's 30 minorities in my class. And as a Black woman, do you find it hard going further in your studies? I don't find it harder going further in my studies. I think there are obstacles in being a Black woman in academics or in medicine or just in general. But I think I've been through a lot in my life as far as being a Black woman or just being a Black person that nothing really phases me anymore. I think if you're starting to have those experiences while in college, it's a little different and it's a little harder. But yeah, I'm fine. I'm waiting at the door, really. Okay. I mean that in the most sincerest, sweetest tone. But yeah, there's times where, classmates think that you're your friend that they were just talking to, even though there's not that many black girls in the class. And there's times when I've shadowed a doctor and a patient asked me if I got into medical school at a black school because that's the only way that I would get into medical school. And you just have to kind of answer them in the most respectful and thorough manner and just be above the ignorance. So, yeah. But internally, yes, I'm waiting at the door. Somebody asked, how good is your Spanish now? Oh, yeah. So I was like going hardcore with my Spanish, studying Spanish with my Spanish coach during my first year, and then second year hit, and I fell off for like 4 months, and now I'm back, and my listening is pretty good enough, because I was watching a lot of the Spanish sitcom called La Familia Peluche, which I love. It's so funny. So yeah, so my listening is pretty good, but my speaking not so much because I haven't been like talking because they say if you don't use it, you'll lose it, and I believe that, and that's true. So I do need a Spanish speaking partner. If anybody wants to Skype with me or something like that, so I can keep my Spanish up. Someone asked, I'm a high school senior. I just got accepted to university for electrical engineering. I want to become a dental hygienist. Should I go to community college and do prerequisites and then apply to a program, or go to the university for electrical engineering and do prerequisites there? Well, that's interesting. I think electrical engineering and dental hygiene are on two different spectrums. I mean, if you really like dental hygiene, I would apply, but truly, I would really become an electrical engineer. But as far as the hygiene program, you could also just find a program that you can get in directly if your state or country has that option, instead of doing prereq and then applying to another program. But yeah, you can do your prerequisites at a community college. Just make sure you know the schools that you want to apply to so that you know the exact prereqs that you need so that you don't do more than you're supposed to or do less than you're supposed to. Someone asked, I'm looking at dental hygienist school. The program is 2 years, but I want to pursue my education and also become a dentist in the future. Will I become a dentist if I'm a dental hygienist first? No. Becoming a dental hygienist does not mean that you will automatically become a dentist. It was just a stepping stone for me, and it was more like backup. If I didn't become a dentist, I would still be in the dental field. You don't have to become a dental hygienist to become a dentist. You can just go straight to dental school, and I would recommend just doing that. But before going to dental school, make sure that dentistry is really what you want to do, and that is done by shadowing a dentist for at least 20 hours, just seeing what they do and seeing if you really like that. Because had I shadowed a dentist, I would have realized that that dentistry, becoming a dentist, was not for me, although I did like dental hygiene. Let me see. Someone asked, if you're a hygienist, do you still have to do 4 years of college and then try to get into dental school? Yes, you still have to. Well, you don't technically have to do 4 years of college, but if you're a dental hygienist, you will have to do the prerequisites. for dental school, and that doesn't have to take 4 years. That can take 2 years, 3 years. It depends how fast you're doing it or how many classes you're taking at the time. But yeah, you will have to do the prerequisites for dental school because your dental hygiene credits does not transfer, because a lot of the courses in dental hygiene is considered allied health. It's kind of like nursing and medical school, which brings me to another question that someone asked me about if medical school and nursing school are similar. And the answer is no. So nursing school and medical school are similar in certain aspects, but they are different in many aspects. So nursing school will grant you a bachelor's degree, and you will go on to take your NCLEX and get licensed to become a nurse, which is an allied health professional. So a nurse basically works under the doctor's license, and you can you do have a lot of responsibilities and duties as a nurse, and the coursework for nursing, which I'm not a nurse, but my sisters are nurses. The coursework is, yes, it's heavily like science-based, health-based. So as a nurse, you're not in a position to diagnose diseases and prescribe medications. So when you're learning information, you're not going to go as deep as medical school textbooks would, but you will know, the general basis of a disease. But you're probably not going to know it down to the, pathophysiological aspect. Like if you're thinking about diabetes, for instance, you're going to learn, how a patient presents with diabetes and the treatments for them. But in medical school, you're going to learn that there's T cells that have these cytokines and secrete IL-1 and TGF, whatever, and that is why the pancreas starts to break down and cannot spill out that insulin that you're supposed to be getting and stuff like that. And you're not going to go all the way down to the physiology of the disease. So yes, so nursing school, you can become a nurse in 2 years with an associate's degree in RN, or 4 years with the BSN. Medical school is 4 years of medical school, and after that you have to do a residency, which is a minimum of 3 years at a hospital, which you're continually training to become a doctor. You are a doctor after your 4 years, but you're not a practicing physician after your 4 years. You're not a practicing physician until after your residency, whereas nursing, once you pass your NCLEX, your boards, you are a registered nurse. So those two tracks are much longer. In general, medical school has a lot more coursework per exam. The stakes are higher because you are diagnosing people. People's lives are in your hands. It's up to you to know what to do for that patient who is about to flatline or who comes in presenting these different symptoms. It's up to you to prescribe the best medication to keep them alive. It's not up to the nurse to do that. So I think that's all the questions. I think I've been talking for way too long, and I think I'm avoiding obligation as far as studying and all that good stuff. So that was really fun answering all your questions, and I'm sure you guys probably have more questions, so leave them below. Don't forget to subscribe and put on your notification bell, and I will be hopefully giving you guys more videos as the year continues and trying to keep up more with my YouTube. And I hope you guys are having a great day. This was exciting. This was fun. And bye.